Staying on top of all the developments when it comes to the COVID-19 vaccine. Governor Larry Hogan says all levels of government and the private sector need to do more to get the vaccine out to as many people as possible. The government's comments come on growing concerns over the rollout of the coronavirus vaccine that's been slower than expected. According to the CDC, the country is falling short of its goal to distribute 20 million vaccines by the end of the year. So far, only 2 million doses have been administered out of the 11 million that were shipped. And here in Maryland, only 19% of its vaccine supply has made it into the arms of healthcare workers and nursing home residents. WMAR 2 News' Ray Strickland joins us live from Johns Hopkins, where vaccination started 2 weeks ago. But Ray, to distribute the vaccines quickly, the governor says states need more support from the federal government.
Wow, the call dropped.
As hospitals brace for yet another surge of COVID-19 cases, the rollout of the much anticipated vaccines are off to a start slower than expected. The country is millions short of its goal to vaccinate 20 million people by the end of the year. Here in Maryland, the state has administered only 19% of its vaccine supply, but the health department says that number will continue to grow as the process is beginning to ramp up. On Tuesday, the state says more than 8,000 people were vaccinated, the highest single-day total yet. Officials believe these vaccination numbers, though, could be higher because of a lag in reporting. But during an interview with CBS this morning, Governor Larry Hogan did acknowledge some hospitals are having a tough time administering the vaccine.
So it's not just sticking needles in arms. There's a lot of moving parts, and I think nobody is quite performing at the top capacity.
The expectations were a little too great to begin with.
Bob Atlas is the president and CEO of the Maryland Hospital Association. He says hospitals did run into some shipping and logistical issues. Atlas expects those problems will get addressed and predicts vaccinations will increase by the thousands soon.
These are, I guess, problems you'd almost expect. We're not seeing there's nothing catastrophic happening here. It's just a little bit of logistical mess.
Governor Hogan says some of these issues could have been avoided if the federal government offered more support, but he says there's no need to point fingers and instead says everyone can and must do better.
We all need to be ramping up if we're going to get this enormous job done across the country.
And another note, Bob Atlas told me another reason why the rollout of the vaccine has been slow is because healthcare workers, to some degree, are still skeptical about getting the vaccine. Now, here at Hopkins, the hospital says about 6,000 of its employees have been vaccinated, and at UMS, they vaccinated about 9,100 of their employees. In total, more than 36,000 people have received their first dose of the vaccine. Live in Baltimore, Ray Strickland, WMAR 2 News.